part of this webinar about the policy, practices, and innovation in surveillance and case management of malaria elimination on this occasion of World Malaria Day. As you are aware, malaria is an important public health problem. Though malaria is a preventable and treatable disease, it continues to have a devastating impact on the health and livelihood of the people around the world. Recent report from WHO has shown that the burden due to malaria is constantly increasing. The disease burden had increased from 227 million in 2019 to 241 million cases in 2020. This clearly indicates the increasing trend of the disease, which is reflected in the mortality number as well. Understanding the gravity of the situation and need for new advances in malaria control, WHO had declared the theme for this year Malaria Days as Harness Innovation to Reduce the Malaria Disease Burden and Save the Lives. No single tool that is available today will solve the problem of malaria. We all know. WHO is calling for investment and innovation that bring newer vector control approaches, diagnostics, anti-malarial medicines, and other tools to speed the pace of progress against malaria. I believe that this webinar will be an eye-opener and will help us to proceed in that direction of reaching the zero malaria target. I learned that around 500 doctors have registered for today's event. I appreciate IMA Junior Doctors Network, Dr. Anirban and his team, Dr. Venkatesh Anirban and his team, for taking such an initiative, which is a need of our. Along with all other participants, I am also eager to learn from Dr. Kaushik Sarkar, who is apt person to talk on this topic. And I thank you for Junior Doctors Association for giving the opportunity to be a chief guest in this program. And thank you everyone.
Thank you, sir. Thanks a lot for guiding and motivating us, sir. Now I'm glad to introduce Dr. Anirban, sir, Assistant Professor of the Department of Community Medicine, RG Medical College, Kolkata. I request Dr. Anirban, sir, to give the opening remarks.
Thank you, Venkatesh, and thanks to our chief guest, Dr. CM Singh sir, Professor CM Singh sir. And this is a very innovative opportunity for us to have Dr. Kaushik Sarkar is one of the pioneer worker in this No Malaria initiative in India. And World Malaria Day is recognized globally on 25th of April every year with the aim to spread the awareness about the disease, about this disease. This year's theme is just the harness innovation to reduce the malaria disease burden and save lives. If I consider our country, the India is amongst the 6 countries that are most prone to have the infection of malaria. And it has been estimated that malaria impacts 241 million individuals globally in 2020. You know, the COVID impact was completely there. Still, we are having that kind of huge malaria burden throughout the nation, and global scenario is the same. The early diagnosis and treatment of malaria are most important steps, else it can lead to complications or that can be fatal, that can lead to the death. And there are several pockets in India which are actually the malaria endemic zones, and there are some kinds of vaccines are there has come with some kind of policy making. If I consider the journey from the last 15 years, for the last 15 years, we have reduced the malaria burden, but it's not that significant. Dr. Sarkar will help us and brief us about the scenario.